Hello, my name is Corinne Zimmerman. I have been a registered nurse at KSB Hospital for over 21 years. My current role is the Emergency Department Manager, and I'm also the co-chair of the Sepsis Committee with an amazing co-chair, Nicole Fisher, RN from Quality. We are proud of the work we have done here at KSB to give quality care to those with sepsis. September is Sepsis Awareness Month, and we wanted to share some education to help the public be aware of the danger of sepsis and how they can know the warning signs. Please watch this video shared by the Sepsis Alliance.
Every year, more than 1.7 million people in the U.S. are diagnosed with sepsis. Over 350,000 people die from sepsis every year in the U.S., which is more deaths than prostate cancer, breast cancer, and opioid overdoses combined. In fact, sepsis is the leading cause of death in U.S. hospitals, and it is the #1 cost of hospitalization at around $53 billion annually. But although sepsis is extremely common, there are many misconceptions and unknowns about sepsis among the general public. So, what is sepsis? Sepsis occurs when our body has an overwhelming and life-threatening response to an infection. When our immune system is healthy and working properly, it works to fight germs like bacteria, viruses, fungi, and parasites to prevent infection. But for reasons we don't entirely understand, sometimes our immune systems escape our normal controls and become erratic. This is the start of sepsis. Sepsis is a medical emergency that needs to be diagnosed and treated immediately. In fact, the risk of death increases between 4 and 9% for every hour that treatment is delayed. Untreated sepsis can lead quickly to severe sepsis and septic shock, which can result in a variety of serious problems, leading to organ dysfunction, a dangerous drop in blood pressure, and even death. Many sepsis survivors live with ongoing challenges, which may include amputations, difficulty with memory or concentration, anxiety and/or depression, plus a compromised immune system, which can lead to a higher risk of getting sepsis again in the future. Everyone is at risk, but especially infants, older adults, those with chronic illness, those with weak, impaired immune systems. When it comes to sepsis signs and symptoms, it's about time. The mnemonic TIME can help you recognize some of the signs and symptoms that one might experience. Remember, somebody with sepsis could experience any one of these signs or a combination of signs and symptoms. T stands for temperature, so be sure to look for temperature that is higher or lower than normal. I stands for infection, so watch for other common signs or symptoms of infection, especially if you believe the suspected patient was exposed to someone else with an infection. M stands for mental decline, so if you notice someone who is confused, sleepy, or difficult to wake up, it could be due to sepsis. E stands for extremely ill, so if you encounter someone who is in severe pain or discomfort, is experiencing shortness of breath, or has other extreme symptoms, it could be due to sepsis, and you should seek emergency care. If you suspect that someone you know might have sepsis, get them to an emergency room or call 911 right away. Emergency medical teams are best equipped to care for a patient with sepsis. So tell the medical care team that you are concerned it might be sepsis. Like anything else, prevention is the best plan, and infections can be prevented by practicing good, consistent hygiene, avoiding people with infections, and getting recommended vaccinations. Washing hands properly multiple times a day is one easy way to help prevent infection. Caring for wounds is also important. Every cut, scrape, or break in the skin can allow germs to enter your body and possibly cause an infection. So it's vital to keep wounds cleaned and covered until they heal. Vaccines have been developed for the prevention of many viruses, such as the flu, chickenpox, and COVID-19. Getting recommended vaccinations can help prevent getting these infections or becoming severely ill from these infections. If an infection does occur, follow the appropriate steps for treatment, including taking antibiotics or other medications prescribed by your doctor. This can help prevent that infection leading to sepsis. Lastly, after a hospitalization, it's important to follow instructions for post-hospital care. such as taking all medications as prescribed. Sepsis is the #1 cause of hospital readmissions, so following a doctor's orders after release from the hospital is vital to helping prevent an unplanned trip back to the hospital. At Sepsis Alliance, it's our vision to create a world in which no one is harmed by sepsis. Learn about prevention, detection, care, and more at sepsis.org.
As you can see in the video, sepsis starts with an infection that overwhelms the immune system that can lead to organ damage and death if not treated in a timely manner. Anyone can get an infection, and almost any infection, including COVID-19, can lead to sepsis. In a typical year, at least 1.7 million adults in America develop sepsis. At least 350,000 adults who develop sepsis die during their hospitalization or are discharged to hospice. 1 in 3 people who dies in a hospital had sepsis during that hospitalization. Sepsis, or the infection causing sepsis, starts before a patient goes to the hospital in nearly 87% of cases. So we're hoping by giving the public some education that we can lower that number and save lives and prevent end organ damage that could last a lifetime. Common infections that are causes of sepsis are pneumonia, urine infection, skin infection, and any virus. These aren't the only sites of infection. Any virus can cause that, any infection can cause that, but those are the most common. As I mentioned in the video, prevention by hand washing and good hygiene and following up early on infections can help prevent the infection part of sepsis from ever developing into the organ damage part. Risk factors for sepsis are infants, older adults, those with chronic illnesses, and those with impaired immune system. 80% of sepsis patients are 50 years and older. We want the public to know the signs of emergency conditions, and sepsis is one of them, just like stroke and heart attack. We can use the TIME acronym to help us remember things to watch for with sepsis. The T stands for temperature. That's temperature that's higher or lower than normal. Lower temperature is a risk, especially in young infants or chronically ill, seriously ill adults. Infection. Sepsis starts with an infection. So any signs of infection, which would be fever, reddening of the skin, cough, upper respiratory symptoms, feeling like you're having symptoms of urine infection, is part of the I. So you have to have an infection in order to get sepsis. You can have an infection and not have sepsis, but you must have an infection in order to be diagnosed with sepsis. Mental decline. This is where somebody you know well is confused, they're sleeping all the time, and difficult to arouse. So especially people who know somebody well, this is where your family members, when they're checking on you if you're sick, can capture one of these early signs of where your mental status is changing. Being extremely ill, being in extreme pain, shortness of breath, all those are concerns for sepsis. So we can remember the TIME mnemonic to help us capture some of the warning signs for sepsis to get care as timely as we can. Many people who present to the emergency room, that is where they're going to receive the sepsis care. So please call 911, have an urgent doctor's appointment, and we would be glad to see you in the emergency room if you need care so we can get your sepsis treated in a timely manner. Children are also vulnerable to sepsis, especially young infants. Each year, 75,000 children develop sepsis, with the youngest being the most vulnerable. Any child who is under 5, who is not eating, vomiting repeatedly, and has not urinated in 12 hours is a concern. And any child of any age who feels abnormally cold, looks mottled, meaning your skin looks whitish and has patches on it, bluish or has very pale skin, has a rash that does not fade when pressed, is breathing very fast, has a convulsion or suspected seizure, or is very lethargic and you're unable to wake them up. That is an emergency, and we'd like people to be coming to the emergency room to be evaluated to be sure that they're not showing signs of sepsis. For every hour treatment is delayed, the risk of death increases by as much as 8%. So sepsis is a medical emergency, and seeking care in a timely manner is important. We are proud of the work we do here at KSB to treat sepsis. We have a sepsis committee, including doctors, nurses, lab, and pharmacy from multiple departments that reviews all the care given to sepsis patients, provides education, and tracks and trends our data. And we're actually very proud of the care we provide here at KSB. CMS, which sets some of our care standards for hospitals, set a benchmark for 60% of sepsis meeting their care requirements. 60% is their goal. We set a goal of 80% here at KSB because we felt like we wanted to give as many patients the best care possible. And we're proud to report in 2022, KSB achieved the sepsis metric 95% of the time, and we are a leader in the state of Illinois on this. We're also very proud of our sepsis care that we have received a sepsis honor roll as commendable. There's 4 tiers for hospitals. We did a self-assessment, and we always feel like there's room to continue to improve and grow. So KSB is proud that our sepsis honor roll status is commendable, and by sharing community education, working with our long-term healthcare facilities to make sure our most vulnerable population can get treated in a timely manner for sepsis, and giving detailed discharge instructions to help hospital readmissions for people with sepsis. We're hoping to raise that goal to exceptional. Thank you for joining us today to learn a little bit about sepsis.